Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Bisoprolol. Its brand name is Zebeta. Now before I talk about this medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how bisoprolol works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe bisoprolol. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does bisoprolol work? Well, bisoprolol is a cardioselective beta blocker. It inhibits beta-1 adrenoreceptors. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure. It can also be used to treat congestive heart failure, and some off-label indications may be migraine prophylaxis or prevention, as well as chronic angina pectoris or chest pain. With respect to contraindications or reasons we would not be able to prescribe bisoprolol, we wouldn't give this medication who had a hypersensitivity to bisoprolol or any other component of the formulation. If a patient had cardiogenic shock or severe sinus bradycardia, they would not be able to use this medication, as well as patients who have second or third degree atrioventricular block. Patients with overt cardiac failure would also not be able to use bisoprolol. Now what about dosing with bisoprolol? So in the treatment of hypertension or high blood pressure, we may see an initial dose of 5 milligrams orally once daily. Some patients may start with 2.5 milligrams daily rather than 5 milligrams, and then you would titrate to effect. In congestive heart failure, we may see an initial dose of 1.25 milligrams orally once daily, and the maximum dose in this setting would be 10 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using bisoprolol, so I'll go over some of those here now. 2.5 to 3.5% of patients may experience diarrhea, while 9 to 11% may experience a headache. Rhinitis may occur in 3 to 4% of patients, and 4.5 to 5% may experience an upper respiratory infection. 6.5 to 8% of patients may experience fatigue. That's all we're going to talk about today with bisoprolol or Zebeta. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.